Hello. A recent report by the Nurses and Midwives Association found 94% of aged care workers in New South Wales had transferred a resident to hospital following a fall in the past year, putting an additional burden of around 3 million on the state's already struggling public hospitals. 75% of those same aged care workers said that falls could have been avoided if there were better staff ratios in their facilities. Minister, when will the government stop pandering to the profiteering aged care companies and introduce mandated staff to residents ratios?
And Minister, I should tell you, Gabi is from the New South Wales Nurses and Midwives Association. I should also say we had literally probably 100 questions from nurses, RNs, or people working in the system making the same point. Ratios. When are we going to get to it, and why not?
Well, I understand that that seems to be a simple way to look at trying to change the way that the system works, but it's not necessarily, on the evidence that we have, what's the thing that's going to provide the answer.
What is that evidence? What would be wrong with it?
Well, there is no evidence to suggest specifically that just ratios are going to make all the difference.
No.
And so we don't support that. But what we've done in the new residential aged care standards that we introduced, and I mentioned before, on the 1st of July, is a requirement to provide the level of care that's required, including clinical care, which is one of the issues that comes up as a part of this process, particularly around nurses, that provides an effective, high-quality level of care across the sector. So we don't support ratios. There are variabilities between facilities based on the needs of the residents in each of the facilities. So a simple and blunt instrument like providing ratios within the facilities isn't necessarily, across the board, isn't necessarily something that's going to be, in my view, sustainable. But it isn't necessarily, on the evidence that I've seen, going to provide the answer towards providing care.
All right, a blunt instrument, Sean?
Thank you so much for your question, and thank you for your service, for you and the other RNs and all the other people that work in our sector. Look, good quality staff with the right skills and the right training are fundamental to good care. Every provider I meet, whether it's an RN, a facility manager, a care manager, I haven't met one that hasn't said to me, we don't want more staff, we don't want them better skilled, and we don't want them better remunerated. So there's something to say we know we need more staff. Now, a mandated staff ratio is one way to achieve that outcome, but it's not universally supported. Now, we know the Workforce Task Force did a strategy last year. We know the AMA and the ANMF have come out and recommended this. What the strategy recommended and what the AMA have recommended is to conduct research for optimum staffing models for the Australian system across all the different models of care. And that's a piece of work that we're currently doing, and we'll be looking forward to working with the ANMF and others when we can share that, because we've got to get this right. It's fundamental to getting it right.
If that piece of work comes back and says, yes, you need mandated ratios and you need, for instance, a registered RN 24 hours a day, which I think is what the AMA and the nurses recently came up with, will you then support ratios?
Well, I think it would have to. I mean, but the outcome we want here is good quality care for older Australians.
Yep.
And if that's the best way to realise that outcome, then that's what we should be doing.
Sarah?
Can I just say, you know, on that topic of the blunt instrument, of ratios being a blunt instrument, another synonym for blunt instrument is bare minimum. We're talking about a bare minimum number of staff here. And as someone whose parent has suffered repeatedly from lack of staffing, that's caused Dad broke his hip. He broke 6 ribs from falling. Both of those incidents were because no one was there to help him, and so he had to help himself and tried to get himself around. When you have been, with respect, on the receiving end of those kinds of injuries, the first thing that comes to mind is how can we get a bare minimum number of staff? And I frankly think the fact that there's not an RN on site in aged care facilities in Australia 24 hours a day is outrageous. These are people with complex needs.
Minister, just to your point, it won't solve every problem. It's a blunt instrument. I mean, do you think it's acceptable to not have an RN on staff? There might be 50 patients, 100 patients, no RN?
Well, it depends on the care needs of the residents. I think that's the critical point.
Yes, but there will always be a mix, won't it? And it will
Well,
always change.
it will always be a mix, and it will always need to...
There will always be high care residents?
And what the standard says is that the facilities need to have the appropriate staff on site at all times.
What's the appropriate number of staff for 50 people in a ward?
That's a matter for the facility to determine. They need to have an appropriate level of staffing on site at all times to provide the appropriate care for the residents.
Okay.
That's what the standard says, and that's what they're assessed against.
Julie Collins, what's Labor's position? Because you haven't come down for ratios either, have you?
Well, what we've said is we believe there needs to be more staff, they need to be better trained and better paid. We've been very clear about that. We've also said that we think there should be a nurse on 24 hours a day on site, because I think there's a community expectation, as Sarah has said, that when something goes wrong, particularly in the middle of the night, that there will be a nurse there to help your loved one. That is people's expectations and the community's expectations, and I think that we can deal with that. But the workforce issue is a really serious one, because the Workforce Task Force does make 14 actions of government, and one of those is about a minimum qualification of a Certificate 3 for aged care. I am very concerned that some of the staff don't get enough training and enough support in aged care to do their job. They want to do it really, really well, and they're working so hard to do the best possible job, but they don't have the training they need to do their work in every situation.
Maggie, I'm going to leave you there for a minute because I'd like to do a fact check here if I can, with maybe use Joseph there as a fact checker. Joseph, you've been in this industry a long time. You're a geriatrician. What's your response to what you've heard here in terms of from our politicians and the people representing the sector?
So I think ratios is a simplistic approach to a complicated problem. We need a bare minimum of staff, is no question of that. It's not just more nursing staff. We don't have enough physiotherapists, occupational therapists, speech pathologists, psychologists, mental health. And you need to have a staff ratio that matches the mix of residents that you're looking after. There's no point having a whole lot of nurses if the residents need allied health support. Yep. What we don't have is enough staff to start with. If we accept that ratios are the answer, then that will not solve the problem in the future. I think the important thing is everyone's been talking about the football. Both teams have the same number of players. How well they work together is how well our facility runs. It's not just about numbers. And I think we become delusional if we think numbers is the answer. But I think Julie's right, if we don't have a minimum to start with, but we've got to be able to think through what are the needs of the residents, what are the professional groups that are needed, and how do we deliver that. And the government missed an opportunity over 10 years ago when we trained more doctors and nurses instead of training people with the skill sets that are needed for the future. And we continue to go back to old ways of doing things, and it's the old ways of doing things that have led us to the problem that we've got today.